What advice would you give to women so they can advocate better for themselves around HIV and menopause care? And what would you say that doctors need to do differently?
I think the first thing is that women should have conversations. Women should start talking about it. We should all talk to all our friends and also talk to people who are not our friends. Just talk about it so that it becomes something that we're not afraid of, not ashamed of. We were talking earlier about what men know about menopause. Talk to men. Let men understand what women go through. So I think conversations with each other are really important. I think it's also important to understand what the symptoms are. And one of the things that I didn't mention earlier, which I should have, is that often one of the confusing things for women and also for clinicians is that menopause symptoms are very often very similar to symptoms of HIV. And so sometimes women are confused about what's related to their HIV and
Mm.
what's not. And very often, because women are diagnosed with HIV late, they very often have symptoms. And so even after they've been on treatment for a while and their symptoms have been controlled, when menopause starts, they start to experience similar symptoms again, and then they worry that their HIV is not
Mm.
controlled. So it's really important that women understand what's happening to them and that clinicians do too. In terms of what clinicians have to do, I think it's important that clinicians understand and that they're aware of the impact menopause can have. And even if they're not themselves able to manage menopause in their patients, they should have good pathways to refer women to experts who can look after them. For women who feel that they can't for whatever reason, because, as you said, if you've had a bad experience with healthcare, I think it makes you unconfident to advocate for yourself because you don't know whether you'll get the help that you need. So I really always encourage people to take a friend with them. If you know someone who is good at advocating for herself, take her with you, and then she can advocate on your behalf because it takes a village.